Happy Friday. I'm back here live. Dr. Joel here. Just wanted to come on and talk a little bit about osteoarthritis. Specifically, we're going to get into the knee, but let's talk about what osteoarthritis is. For most people, we're going to define osteoarthritis or arthritis as age-related changes in the joint, where on X-ray or imaging, it appears that it is bone on bone. And those terms are not necessarily an end-all, be-all for anything. I mean, when we talk about arthritis, what we want to do is discuss what that actually means. And so what it means is normal age-related changes are going to appear on imaging and be described as arthritis or osteoarthritis. Arthritis broken down just means inflammation in the joint, but when we talk about it medically, we're talking about joint-related changes related to your age, right? So someone in their teens or 20s might have very little signs of arthritis depending on activity level, and as we age, those changes become more and more. Okay, so what we're seeing is when you get into your 50s, 60s, and 70s, you may have a lot more arthritis. And I use quotes around that in your knee because it is just a normal age-related change. It does not mean that you have pain. It does not mean you will have pain. It does not mean you had pain. Now, you may have pain, and it may be related to that. So it gets kind of confusing. So what we want to look at and talk about with this is how can we alleviate some pain in our knees that may be diagnosed on imaging as osteoarthritis? Well, the first thing that I want to talk about is a common phrase that I use for a lot of patients and a lot of joints is motion is lotion. And we want to try and lubricate those joints, get them loose. So things that make you move your knees, walking, riding a bike, squats, lunges, anything where you're moving your knee is going to be beneficial for your health of your knee. Okay, it's going to decrease any chance that you have symptoms or any symptoms that you do have. All right, so we want to keep moving and move those knee, especially when we've been diagnosed with osteoarthritis. Okay, I would just call it age-related changes, and sometimes it might be painful and sometimes it might be not. So let's not take too much out of that X-ray image. But here is what an interesting study that came out a little while ago found that people that run recreationally have decreased amounts of changes in their knee as opposed to people that don't do anything. All right. So it found that 3% of people that run moderately, moderate mileage in a week have less knee changes than people that don't do anything. Like 10% of sedentary people will have more knee arthritis, and 3% of runners that do quick little running. All right, and then that's like 3 miles a day, 4 or 5 times a week. All right, so running can actually be beneficial for your knees, believe it or not. And for me, that's great news. I'm not a runner per se, but it's good for me to be able to tell people that you're not hurting yourself by running. Now, there's a different story when we get into people that are doing ultra marathons and things like that, but we'll save that for another time. But what we want to let you know is that by using your legs for running moderate amounts, you will end up having generally healthier knees than if you don't do anything. Okay, so going back to that motion is lotion, running is going to make your knees move, right? Running uphill, downhill, flat ground trails, any kind of running is going to be beneficial. Now, if it hurts to run, then maybe you want to reach out and we can figure out why it's hurting to run. It may not be your knee, it may be something else. But so if you want to get started on a running program, there's great ones out there you can use. You can reach out to me. I can help you get started, but you can also try to use the Couch to 5K. It's a free app on your phone, and that'll get you started on running. But what we want to, the point that we wanted to talk about in this is that arthritis has a negative connotation. When we really break it down, arthritis is just a way for us healthcare professionals to define what happens with the normal aging process. All right. Um, I may be misrepresenting this quote, but I think it's Tim Flynn calls it wrinkles on the inside, right? Like when we get older, we get more wrinkles up in our forehead and on our face and stuff. And we can equate arthritis to just being those same age-related changes and call it wrinkles on the inside. Okay. So the lesson that I'm trying to get across here is that running is not bad for your knees and that moving is better than not moving. All right. If you have any questions about this or any comments, or you run, or you don't like running, or you're afraid your knees are going to hurt, drop a comment in that comment box. All right. We love to hear from you guys. We can respond to everybody. And if you have any questions about anything, go ahead and just ask. If there's something you want to hear more about, let me know. Put that in the comments. I'll talk about it next week. Anyway, thanks for watching, and you guys take care.